New videos every day.
We know that we all have kind of biologically built into us a little bit of a snake phobia, a little bit of a spider phobia, a little bit of a height phobia, which obviously has good survival.
Mm-hmm.
Because if you were perfectly comfortable around poisonous snakes and you just like jumping in piles of snakes, you wouldn't live.
Life, wisdom.
What are you afraid of? In this video, we're talking about phobias. My fear is centipedes. Leave me a comment and let me know what you're afraid of. Dr. Ross, thank you so much for being here.
Always my pleasure.
So tell us a little bit about phobias.
Well, phobias are actually the most common form of anxiety disorder. And on the one hand, they can sound kind of trivial and silly, but they can be very impairing.
Mm-hmm.
So first question would be, well, what's the difference between a normal fear and a phobia? And like many things, there's no sharp cutoff, but a normal fear would just be being afraid of snakes, being afraid of spiders, or being afraid of centipedes. But since you're not around them that much, you're not that preoccupied with them, it doesn't really interfere with your life. It's not really causing any distress.
Mm.
So it's just a fear that you happen to have. It's not a diagnosis. What makes a phobia is the amount of fear is way out of proportion. So you could have just a ridiculous example would be you could have a phobia of paper clips. And anytime you're around paper clips, you just start getting agitated, anxious. Mm-hmm. So clearly it's way out of proportion to how dangerous or creepy the thing is.
Right.
And then the second thing is, if you live in a world where there's no paper clips, you don't even know you have a phobia, it's not a problem, it doesn't need treatment.
Mm-hmm.
So the people who come for treatment, it tends to be somebody I worked with had a fear of heights and had to replace the light bulbs in the gym as part of his job. And that was a pretty tall ladder, and he absolutely could not go up the ladder. And I actually worked with him actually in the gym with the ladder present, trying to desensitize him. And just the first little practice where he had one foot on the ladder and he was going to put the second foot on, he was the most terrified looking guy you'd ever want to see, sweating, shaking. And so another example that's pretty common is small furry animals, which could be small as mice, but basically we're talking cats, dogs, maybe rabbits. And if, say, your daughter has a dog, and every time you have to go visit, they have to put the dog outside, and there's this huge production, and then the kids let the dog back in by mistake, and then the person has a huge terror reaction. Now it's actually interfering with your life, and she starts going over to see her daughter less, and there becomes all these rules about what the dog can do and can't do. So it's the combination of the fear is out of proportion to the reality of the situation.
Okay.
And it's causing distress and it's interfering with your function.
What is the cause, the underlying cause of most phobias that you've seen?
Well, there's lots of theories about that and probably lots of different causes. So you're never going to get, for anywhere in the mental health field, you're never going to get, this is caused by that, end of discussion. There's always many different causes that vary from person to person, vary from problem to problem, and the sort of percentage each cause contributes can vary from person to person. So it's always complicated. And sometimes there's kind of just no rhyme or reason for it that anybody can figure out. And then sometimes it's very clear and very obvious. Right. So in the area I work with, which is big trauma survivors, somebody might have a phobia of men wearing blue baseball caps. So anytime a guy with a blue baseball cap comes anywhere near, overwhelming terror and panic. But along with that, we get a flashback of your uncle sexually abusing you wearing a blue baseball cap when you were a kid. So clearly this is tied into PTSD, but it is a phobia, but it has a clear, specific traumatic origin.
Right.
Another time would be somebody got thrown off a horse, or somebody got bitten by a dog, or somebody saw a really, really scary snake and almost got bit, and then the phobia starts from there.
Right.
So sometimes it's pretty clear and obvious, and sometimes not. And sometimes the phobia can not really be tied to a specific event, it's more the theme. So if you were sexually molested by your dad in the dark, then you might have an anxious, scary, foreboding, something dangerous. I can't take it. I need a drink whenever the sun is about to go down.
Mm-hmm.
So you kind of have a phobia of sunset or of the dark. But it's not really about the dark. It's about what happened in the dark a long time ago.
Right.
And then, like I said, other times there just doesn't seem to be a rhyme or reason.
And what is the treatment? How are you able to handle these patients and provide some relief to these patients?
Well, there's several different kind of levels and types of treatment, depending on if you're not a huge trauma survivor, you're doing pretty well, you don't have mental health problems in general, you just have a phobia. Say you have a phobia of needles and you're a nurse. Well, then you do what's called systematic desensitization, which is a behavioral therapy. So basically, you have to break it down into steps, because you don't want to just throw somebody in a room with 1,000 needles. They'll just be overwhelmed and melt down.
Right.
So you want to practice some relaxation exercises, maybe some self-hypnosis. Then you'll talk with a therapist about the subject until you can calm yourself down just talking about it. And then the next step might be imagining that there's a needle in the room. And then the next step would be there's a picture of a needle, but it's on the other table. And then you're actually holding the picture. And then there's an actual needle on the other table. Calm yourself down, relax, practice, relax, practice.
Mm-hmm.
And then you can actually hold the needle. And by working through it step by step by step like that, you get desensitized.
Right.
And the fear just kind of melts away. And then you go, I don't know what I was so concerned about. And often that pretty simple, maybe 2, 3, up to 6, 7, 8 sessions treatment, it'll do the trick.
Wow.
But if you are afraid of men in blue baseball caps, and you have post-traumatic stress disorder and depression and a substance abuse problem, and you had an eating disorder, and you were sexually abused by your uncle, you can't just do 3 sessions and all your problems are gone.
Right.
Because it's just one part of a huge, complicated puzzle.
Are anti-anxiety medications used for phobias?
Basically, the treatment of phobias is mostly therapy and behavioral. Anti-anxiety medications like Valium and so on are actually, in a way, the best medications in psychiatry. The downside of those medications is you can abuse them, get hooked on them, get stoned on them, and then it just fuels a chemical dependency problem. Mm-hmm. But in terms of how they work, except for the actual effect, which is you get slowed down, you get a little clumsy, if you take a lot, you'll start slurring your speech. If you take even more, you'll go to sleep. Not counting that, they don't really have a lot of toxicity. They don't cause all these horrible side effects that antipsychotics cause. They don't cause suicidal ideation. So a little bit of one of those drugs to just take the edge off enough that you can start doing desensitization for a short period of time might be okay.
Okay. But in terms of a long-term dependence on an anti-anxiety medication to treat the phobia or to make the phobia more tolerable, it's probably not going to be an effective mode of treatment.
Well, the problem is you'll become physically dependent. You'll actually become physically addicted, and then you'll have an addiction problem. So that's the number one reason not to be on long term.
Right. And certainly that would be just switching out one problem for another without really getting down to a solution.
If you just blanket the problem with an anti-anxiety drug, if it's a benzodiazepine, you get physically dependent on it. Mm-hmm. And then when you stop, you've got all the withdrawal problem from the benzodiazepine. Plus, there's no reason the phobia won't just come back.
Right.
So medications really aren't the solution for phobias.
Mm-hmm. So in terms of, you discussed a little bit about the difference between a fear and a phobia is this issue that the fear is significantly, you're significantly more scared of the thing than, what the potential threat of that thing is, so you're just completely horrified of a little tiny spider, which really couldn't hurt you. And you mentioned that oftentimes traumatic events are implicated in somebody developing a phobia. Are there other ways that somebody might develop a phobia, or is it possible to be born with a phobia or something like that?
Well, the basic answer is I don't know. But we know that we all have kind of biologically built into us a little bit of a snake phobia, a little bit of a spider phobia, a little bit of a height phobia, which obviously has good survival.
Mm-hmm.
Because if you were perfectly comfortable around poisonous snakes and you just like jumping in piles of snakes, you wouldn't live. Or if you were, as a kid, totally comfortable with being at the edge of a cliff and you're just playing there and looking over, your survival wouldn't be that good.
Right.
So there is some sort of built-in phobic reaction to scary, dangerous things, which is a good survival advantage. But the idea that you can't really be genetically born, say, with a phobia of hypodermic needles, because there's not a gene for hypodermic needles because they haven't existed for that long.
Right.
So most of the time, it's not going to be you 100% had a specific genetic cause of a specific phobia. That's not realistic.
Okay.
But you can be born temperamentally a little bit more anxious, a little bit more fearful, a little bit more phobic than the next person.
Mm-hmm. And I think it's interesting that you point out that fear really is a survival mechanism for us. So if we didn't have that kind of natural fear of spiders or snakes or something like that, well, that wouldn't be a very survival quality to have. This idea of fear, and of course we all have fears, we all have things that we're afraid of, but it's interesting the perspective that you're sharing here about looking at how our environment influences our fears. And we actually did a video at one time about fear and mind control and how is a fearful society where there's a lot of shows about possible world-ending scenarios and all kind of fear factor type things. Remember the Fear Factor show that got popular? There's also kind of this obsession with fear or kind of entertainment quality with fear. What are your thoughts on that?
Well, there's a concept in the field called counterphobic response, which is big professional jargon sort of thing, but it's also just common sense. So if you're afraid of something, one thing you can do is avoid it, but the next thing you can do is be the big macho person who's right on it. Mm-hmm. So you actually have a phobic fear, but you're countering it by like going head on at it and exposing yourself to it and mastering it, which it can go either way. That can either be a good fear conquering strategy that you're not going to let your fear get you down, or it can be just kind of like holding your nose to the grindstone and grinding your nose up sort of thing. So I think it probably is going to come down to a typical kind of adrenaline rush type issue. Mm-hmm. There's nothing wrong with driving a motorcycle or going on a Ferris wheel or doing anything that gives you a little bit of an adrenaline rush, but then you can become an adrenaline junkie and it starts taking over your life and dominating what you do, and the risks that you take just become extreme. It's eating up all your money and your girlfriend dumps you because you're always doing it.
Right. And I think that, when we think about the Fear Factor television show, that adrenaline rush is probably at the root of the popularity of that show.
No doubt.
So any closing thoughts, maybe recommendations for people that have a phobia or that just have a really intense fear?
Several things. One is phobias can sound kind of silly, like I've got a peanut butter phobia, and they're easy to make fun of. So don't overdo it. If you just have like an everyday normal fear that's not causing that much trouble, I wouldn't worry about it. But if you do have a really intense phobic fear of something, and it is interfering with your life, it's a serious problem. And you should take it seriously. And simple, straightforward, brief behavioral therapy often can be extremely helpful.
Excellent. Well, thank you so much for your time here today.
Thank you.
And thank you for joining us. Please be sure to give this video a thumbs up if you liked it, and leave me a comment letting me know what you're afraid of. I'm Psyche Truth correspondent Karina Rachel. Thank you so much for watching.